Welcome to the 1760 sessions, conversations with leaders building systems that move the needle. I'm Harry from 1760 Strategic AI, back again, and today I'm joined by Emily Bernstein, founder of Wheelhouse Health Navigation Services. Emily's a board-certified patient advocate and community health worker, helping patients navigate our complex healthcare system with clarity and compassion. Emily, welcome to the show.
So much for having me. I appreciate it.
I've been very excited to talk with Emily off the back of our last discussions. What she's doing is some amazing stuff in the healthcare world and helping lots of people that need help. So Emily, I wanted to kick off with a bit of a background story. So what first drew you to say patient advocacy? Was there maybe like a personal experience that sparked Wheelhouse?
Absolutely. So back in 2019, excuse me, my mom was diagnosed with CNS lymphoma, which is a brain tumor. And so she went through chemo, she went through rehab, she had a stem cell transplant. So it was a very, very extensive health journey for her, which we're still going through. She's got lots of ongoing health issues still today, but going through that with her made me see just how much the healthcare system requires someone to help you out, and a caregiver, or not even a caregiver, someone else that is there and involved that can help push buttons and pull triggers for you, so that you don't have to deal with it as the patient. There was no way my mom would have been able to coordinate all the referrals and schedules and discharges and intake procedures and all of this, just the transportation and keeping things running at home. All of those things require someone else to be there for you. So, and it also, all of those things, the medical navigation, it really spoke to my skill set. So I was very excited
Okay.
about the potential of bringing this idea to other people, specifically as well the lower income people who can't afford, a full-time caregiver, and they need a lot of help. So that's kind of where I came from. I started my practice in 2021. So I worked on getting a board certification, and I also took a certificate course just because I had no medical background. So I thought that this course would be, or these courses would be helpful in getting me kind of a baseline understanding of the system. And then from there, I worked under a mentor for a while who was incredible. And
Yeah.
then I launched my own business in 2022.
Okay, what was the aha moment that made you think, right, I can start a business out of this, not only to make money, but also to actually help other people?
Yeah, I remember it very clearly. I was actually out on a bike ride, and I had wanted to start my own business for a long time, and I was thinking through ideas. It was mid-pandemic, and I was working at a travel company, which was a little difficult during the pandemic,
Yeah.
obviously. So,
Yes, of course.
so I knew that it was the right time for me to start a business, and I was just trying to figure out what it was going to be, and thinking through my skill sets, what I was passionate about and what I enjoyed. This really came to me as something that could be scalable, something that could be fundable and would really help other people. So yeah, so it really was I definitely had that aha moment, and I got really excited. I started looking up the certificate programs right away. So
Okay, amazing. That's such like a neat story to have that. Or I think that everyone has that sort of drive to start their own business,
yeah.
but actually having that moment actually clicks, makes you think, actually, this is my turn to actually do good. And generally, most startups start off someone trying to do good,
Yeah.
and yours is in a fantastic sector.
Yeah.
So I wanted to touch on the work you're doing today.
Sure.
For someone who's never heard of a patient advocate, how would you describe what you do day to day?
Great question. So I think a lot of people have not heard of a patient advocate, or they don't know, maybe you've been assigned a patient advocate through the hospital or through your insurance company. But we as independent advocates are a very different sort of breed. And so what we do all day long is we work to ensure that you as the client, as the patient, get the care that they need. And so whatever that may entail,
Yep.
we can cross all the lines. So comparing us to, say, a nurse navigator or a patient advocate from a hospital, they work with the hospital and they're constrained by the protocols and the practices that the hospital puts out there. So we are able to go beyond those lines. We're able to push back on those lines sometimes. When there's something that maybe we need to advocate done differently than what the hospital is doing, especially in the
Yeah.
billing space. That I think that comes in really handy. So we really are there to make sure that your wishes are achieved as a patient. We can help with anything from getting you a wheelchair to helping you negotiate a bill to helping you understand your
Yeah.
diagnosis. Me specifically, I specialize in billing advocacy. So I get a lot of cases where you've been denied by your insurance for coverage for one reason or another, and you know that that's not, a lot of people come to me knowing that that's not correct. They know that this bill is wrong, but they don't know how to fix it. And so I am the one who puts the puzzle pieces together and is able to fill in those blank spaces where we can actually get you answers and get those bills covered by the insurance. Um, there's a lot of people too who come to me with, stacks of bills that they don't know what they actually owe. And so we
Yeah.
go through them together and cross check them with the explanations of benefits. Um, Tons of different cases. Everyone is different. And I always work with the client to make sure that, like I said, their wishes and their goals are achieved. And I always make sure that they're very involved with what I'm doing, because a lot of what I'm passionate about as well is education. So I want
Okay.
you to understand what steps I'm taking. So if this should happen again, then you could hopefully give it a shot on your own. I think that health literacy is something that's really, really lacking in today's world. And people
Yeah.
get so frustrated and they throw up their hands and say, I don't even understand this. I'm just going to pay the bill, which is like
Yeah.
the worst thing that you could possibly do, in my opinion.
Yeah.
Finding an advocate in those moments, especially when you know that there's something wrong, is really important. And that's what patient advocates do.
Yeah, and that education piece is so important because at the end of the day, there's only one of you, Emily, and you can't constantly keep helping that same person over and over
Exactly.
again. So the education piece, you're
Exactly.
teaching a man to fish, essentially.
Yeah, exactly.
Um, you speak a lot about billing. Do you have an accounts background that you've potentially leaned on for help?
No, no, actually. I mean, I was an account executive, so I worked with different accounts at the travel company that I was working for, but nothing. I've
Okay.
never been a numbers person. I'm I've never been a big math person or anything like that, and so it really shocks me that this is what has been my calling. But I like to go into it with a kind of 5-year-old perspective. I like to say, I'm a 5-year old and I ask the basic questions and I really get down to the basics when I'm working with a hospital or with an insurance company. And I think that that really is an advantage because a lot of times people are coming into this with so much emotion. There's so much weight to having these huge bills that are your personal responsibility. So there's a lot of baggage, if you will, that comes with you yourself trying to fix your own medical bill. And so I am able to come in with I mean, obviously I've learned a lot and now I know a lot of the ins and outs and I know the strategy behind who to talk to and when and what questions to ask a lot of the time. But not having any medical background and not having any accounting background has actually been a really big benefit for me, because I'm able to really ask the right questions and get to the basics without all of that baggage involved. I have a kind of
Okay.
objective perspective on it instead of the weighted emotional, you know.
Yeah, of course, and it's amazing to hear that you've upskilled yourself in that,
Yeah.
and this is something that you're obviously upskilling others with. So you've spoken about the different patients. Well, you haven't spoken about the different patients, but you mentioned that you work with patients. I can't imagine it's one size fits all.
No.
So what kind of patients and families do you typically support, and how do you differentiate when you're coming to essentially give them a solution as a patient advocate?
Absolutely. So yeah, no case is the same. And I really have been, I'm kind of positioning myself as the anti-AI advocate, if you will. Not really. I mean, obviously I use AI to do back end things all the time, but there's so many people out there who are like, we'll analyze your explanation of benefits and automatically appeal your claim. And it's just, it doesn't work that way. There's waiting periods, there's hold times, there's all of these things that go into it that make it a really personal experience. Um,
Yeah.
so a lot of the people that come to me are actually caregivers, their parents, their siblings, um their even friends of friends that have called and asked for help. Um, a lot of times those are the people that are able to do the research and find out what a patient advocate is, and then they are the ones who reach out to me. I do you want
So
me
it's
to take
usually not the person, maybe a loved one.
exactly. Most of the time, it's a loved one that reaches out to me to actually get care for the person, the patient themselves. Yeah.
So
Um,
can you next walk us through what a typical case may look like from when someone first finds you to when you've helped them resolve something?
Absolutely. So typically, I will get an inquiry from, be it from one of the, I'm listed on several different directories, the National
Yeah.
Association of Patient Advocates, the Massachusetts area, which is a little more localized. Greater National Advocates is a really incredible resource for people to go find an advocate. So I'm listed on a lot of those, but then I also get referrals from previous clients, from other advocates that are doing different things. So, so I've been lucky to find a very good referral stream of people. And the first step is to have a phone call to discuss what you're going through. So I want to hear it in your words. I want to hear what you've already attempted because most people have also already tried to figure this out on their own and they just got stuck. Um, and then from there, there's a contract and an invoice. And then I use a secure Google Drive where people can upload anything that they've got. And then from there, I do an analysis of, bills, explanation of benefits. I'm a big fan of patient portals as well. So I kind of get my hands really deep and into the nitty gritty of what they're dealing with. And then from there, the hardest part is getting on record as an authorized representative. So say you have a bill from this one physician's office. I'm going to need to get on record with that physician's office. I'll probably need to get on record with the hospital that they have privileges in, and then I'll also need to get on record of the insurance company. So those processes take a long time, and it's really frustrating. Um, but then from there, I can actually, once I'm an authorized representative, it's just as if I'm a loved one calling in on your behalf. And so I can go through and I can ask the questions. I can, figure out, typically take the approach of, okay, if this was your bill, you can look at it and you can see it was clearly denied for this unfair reason. We need to appeal this. We need to look at this in an objective light. Like I said, it's a very unemotional process that I go through. And from there we can figure it out. Do you have $10,000 in your pocket to pay this unfair medical bill? No, you don't. So let's work through this together. So that's typically what I work through with the insurance companies. I do a lot of financial assistance applications, which is something a lot of people don't know exists. And I'm able to help them apply and, usually get approved, which is great. Um, but like I said, every case is different. Every case is different. There was,
Yeah.
yeah,
I can imagine you could probably talk me through a
yeah,
few different ones.
yeah. There was one that was, there was this person who had esophageal cancer and he needed a full set of dental implants, but his but
Oh, wow.
extractions and dental implants aren't covered. So I was able to work with a foundation actually, and they were able to get a full set of implants donated, and then the doctor donated their time. So those are kinds of things that
That's
you can
amazing.
get creative, and you can help people in really dire situations. Yeah.
Okay, that's fantastic. So there's a few different situations there that you could probably walk me through, but for the sake of time, we will move on to the next section.
Sure.
You've covered what your day-to-day looks like. You've covered how the business was started, and I think at the end I'll ask you the ultimate question, and it's actually why you're doing it. But first, now let's look under the hood of the business. So, what does running Wheelhouse look like behind the scenes? Is it just you, or do you have partners or support staff?
Excuse me. Goodness. Sorry. Oh, that hurts. Um, so yes, I have at different points in time, I've had teams. I had access to a lot more revenue streams through Medicaid actually for a good 2 years of my business, and then with all of the Medicaid cuts recently, that was all cut. So right now I'm focused mostly on private pay clients. So it is just me doing the business running and then also the actual client work. I do have one woman who I work with who does all of our podcasts and all our newsletters. We're planning a webinar soon, so she helps me get the word out. Um, and she's invaluable as a partner. She keeps me on track very much so. But right now, yes, so it is just the two of us right now. And it's all remote. I can work with people all over the country, and with any different insurance company. Like I said, I go at it from a 5-year-old perspective. So any company is totally valid to work with, because I start at the very basics. Um,
Okay.
yeah. Any
And
other,
so,
yeah, did that answer your
in
question?
terms of, I can imagine there are some challenges that hold you back just having two of you running the business because you're probably doing the logistics in the back end, and then you also need to do the patient advocacy stuff and actually helping people. So where do you find yourself spending the most time? The advocacy work itself or the admin and just logistics around it?
Very much so the advocacy part. So yeah, doing the actual client work, it takes up most of my time. Um, and I'm working on I'm working on automating a lot of the back end part, which is where I think you guys could come in helpfully. But uh, very much my day to day is meeting with clients or networking at this point. So
Yeah.
I still do a lot of networking with different providers, different like startup in institutions. There's a lot of great resources out there for small businesses in Rhode Island, but also nationally. Um,
Yeah.
so that's most of my day is spent there. The biggest challenge is getting new clients. So any eyes we can have on the business, and spread the word that this exists as an option, and can be a valuable resource for you. Um, any opportunity we have to do that is huge.
Have you considered AI for any of these pieces?
Yeah, absolutely. I'm looking into it and I'm totally open to it. Like I said, I really want to maintain that personalized touch so that it's
Of
really
course.
um, kind of what's the word I'm looking for? Like bespoke advocacy so that it's really tailored to your case. But I know that AI can is a really powerful tool for a lot of different other aspects of what I do, like finding resources, finding clients, finding revenue streams, things like that.
Yeah, of course. And this is something we can touch on outside of
Yes,
the pod.
I would love to.
Um, of course. Apologies if you can hear barking in the background. That is my tiny Pomeranian called Barney, 8 years old. He's been known to bark on a podcast before. So sorry about that if you had
That's
that. So looking forward, looking at the next steps for your business?
Yeah.
What does the next 3 to 5 years look like for you?
Yeah, great question.
We can look at an ideal situation. We can look at where you want to be, however you want to look at it.
Yeah, I am applying for jobs, just to have a little bit more steady of an income. But I would absolutely be maintaining all my clients and maintaining as much as I can with a job. But in terms of Wheelhouse, like if I could scale it into getting enough referrals where I have full-time work, I would really, really love that. I am starting to work with a behavioral health clinic doing actual provider claim appeals, which I think could be a really cool avenue to branch into. Because if an insurer denies the appeal, the patient doesn't get coverage, but the provider doesn't get paid either. And so
Yeah.
it's kind of the double-sided coin. So I think that could be a really cool opportunity for me to break into and work with more providers. And we also really want to double down on that education piece. So we're actually talking about creating a curriculum, especially designed for different populations, that we could then sell as a product. Um, and we could do a lot with the education side of things as well.
Okay, fantastic. There's a lot of different support that you may need.
Yeah.
Um, so running this business has been no easy feat. What lessons have you learned about running your own business?
The, the biggest lesson that I'm kicking myself so much on is don't put all your eggs in one basket.
Of course.
So focusing on different revenue streams and making sure that different opportunities are always available, I think is really important. I was very, very focused on the Medicaid revenue that I was receiving, because I was providing. So for that, I was able to actually provide free services for anyone on Medicaid in Rhode Island. And so that was really valuable because that was the population that I've always wanted to target.
Yeah.
I think one of the biggest questions in the industry right now is how do we help people that can't pay an hourly rate? And so there's big debates about insurance coverage and how
Yeah, I
the
can
pros or
imagine it's
cons of
yeah,
that. So people are really interested in that. Medicare actually covers advocacy as well, but you have to go through a lot of hoops. And so not many practices are doing that individually right now. There are some of those startups that I mentioned earlier with like the
yeah,
directories and things. They're doing the Medicare billing, but I was very focused on the Medicaid. And then when that got cut, it was really hard, because I really lost a lot of my revenue. So I was focused too much on one side of the business, and I just learned that I need to diversify a lot more. I have actually founded a nonprofit as well, and so we'll see where that goes. I don't know. It's called the Wheelhouse Health Academy, so I want that to be where all of my education initiatives are focused through the nonprofit.
we'll attach the link to the podcast.
Awesome, very cool. Well, there isn't a link yet. I haven't done anything.
Okay. I was getting ahead of myself. When
Yeah,
we do have a link, I'll make sure it's attached.
yeah. So it's a very new idea, but I'm working through some different avenues and different ways of diversifying that revenue because I think that's one of the biggest challenges for sure.
Okay. So you've mentioned quite a few things, and what I keep thinking about in my head is this work must be quite emotionally taxing for you. Um, how do you go about on a day-to-day basis taking care of yourself whilst also taking care of other people?
Yeah, yeah. The billing side of things is not as emotionally taxing because again, it's not like I understand I can completely empathize with the people who are dealing with this debt on their own. But it's sometimes I don't even know what is wrong with, like what happened, what the bill is for. Sometimes I just know that they have this bill. And so it's easy to just differentiate myself from the actual medical experience. I have been getting into a lot more care management lately through some contracts that I've been doing, and that's a lot more focused on the care side of things. So getting people referred to specialists, getting people transportation to appointments, getting them equipment, medical equipment. Um, you know, housing is a huge part of it, and those really do weigh on me. So,
I
um,
imagine.
yeah, definitely. And so I think, but all the wins really make it worth it. Like when you're actually able to get somebody a wheelchair delivered or find them new housing that works for them or get them referred to a new specialist, like all of those wins are just so satisfying. And that's what I always strive for. And then same with the billing, like with billing advocacy, when you get that bill written off, it's just so satisfying.
I think it's important to remember that you're essentially changing someone's life here.
I have
And
in several cases, yeah.
the work that you're doing is amazing. These bills can be such a burden of not only financial burden, but of stress.
Absolutely.
Having had large bills myself, probably nothing compared to the US medical system, can leave someone under a large amount of stress, large amount of pressure. And what you're doing is you're relieving them of that. But always make sure to take care of yourself, Emily.
Yes, yes, definitely.
So I think that kind of gives the big picture on why you do this.
Yeah.
Is there anything to add on that side of things?
Um, no, it is just, like I said, it's so satisfying. I'm one of those people who doesn't take no for an answer. And so I'm really, like I said, I think this really plays to my strengths, in the sense that I
Good.
can just really, I just keep pushing back and keep pushing back. When they're denied for financial assistance, the next question is why, not, oh, okay, that's the answer, that's that. The question is why. What do they need to provide to prove that they're eligible? Because I know that we can get there. So I think that it just really plays to my strengths, and I just love doing this work for other people.
That is amazing, Emily.
Yeah,
Um, and look, even in the short time that we've got to know each other, I can tell that you're incredibly personable, and I can tell that every patient that's dealing with you will be very lucky to have you on their side,
thank
especially as I now know that you don't take no for an answer.
you.
So,
My motto
I'd
is
just
the
like to thank
squeaky wheel gets the grease. So I'm
the
always
squeaky wheel gets
the
the
squeaky
grease.
wheel. Yeah, absolutely.
I remember you saying that to me before. So,
Yeah,
Emily, this has been brilliant, and thank you very much for sharing so openly.
of course.
Um, what I'll be doing is sharing this podcast out. And if anyone wants to reach out to myself or Emily with any more questions, please do not hesitate to do so.
Absolutely.
And thank you very much. I'm going to hit stop. And then we should